I'm optimistic that we can end AIDS as a public health threat.
So the science of HIV has actually never been better. We know how to stop HIV, we know how to treat HIV.
When it comes to tackling HIV, I think what we've learned is that working together is important.
We have 25 million people on treatment, but we have another 15 million who are not on treatment.
And what bothers me a lot is that even in the context of huge antiretroviral treatment rollout, we're still seeing nearly 700,000 people dying from AIDS. Young people are particularly vulnerable. In fact, almost 1 in 4 infections that take place each day is in young people under the age of 25.
If policies do not respond to the needs of key populations, then the likelihood that we are going to beat the epidemic is not possible.
The HIV Policy Lab is a unique collaboration between an academic institution, Georgetown University, UNAIDS, and civil society groups around the world to track which countries have adopted which policies related to HIV over time and across years. We're tracking 33 different indicators across 4 different policy areas: treatment and clinical care, prevention and testing, the structural issues, including whether things are criminalized, whether girls have access to education, etc., and then policies around how the health system is structured, including health workforce and health financing.
Policy matters a lot. A policy lab would allow countries to link up with the others that have implemented those policies.
If you're able to tell that 5 countries in your region are moving a policy issue and your country is not, that's a very important political advocacy tool.
It will establish a database through which we can know how countries are applying the guidelines that we give them.
The HIV Policy Lab will act as a really important resource for researchers like myself to ascertain what are the policies that are active in any one setting.
For us, for the global network of people with HIV, we're going to use it as a way to inspire. We're going to share that with the country networks, because then we would understand and we would actually have hope in terms of where our country should go into.
The good thing is that we have enough evidence to show what works, and definitely policies around comprehensive sexuality education, keeping girls in schools, access to treatment, decriminalizing the transmission of HIV, decriminalization of key population, and sexual reproductive health and rights policies. Those are policies that we learn that help to respond to HIV.
What we want the HIV Policy Lab to be is a living organism in which all parts of the HIV policy response are feeding into what that looks like.
Policies are the difference between whether countries are able to change the trajectory of the epidemic or not.